As Breast Cancer Awareness Month starts to come to an end, we wanted to talk about some of the lesser known symptoms today. We have Dr. Ahmad Zarzour. He's with us from the Toledo Clinic Cancer Centers. So doctor, thanks for joining us today.
Thank you for having me.
Many people know that a lump is one of the kind of common symptoms or triggers to why you have breast cancer or getting tested for breast cancer. So what are some of the other things that we should know about when it comes to finding things with breast cancer?
Absolutely. So some other symptoms that could indicate having breast cancer would be a change in the breast size or a change in the skin of the breast. Some side changes in the nipple as well could mean breast cancer. The other thing also to watch for is lumps in the axilla and the armpit. That also could be a swollen lymph node from breast cancer. So if that happens, the patient needs to talk to their primary care doctor or their treating physician about getting tested and evaluated for breast cancer.
How often should we check? I feel like maybe sometimes people might not know how often they should check and how they should check and where they should check.
Yeah. So there's no clear guidelines about that. Typically, we recommend at least once a month patient feels their breasts and their armpit to make sure there are no lumps while they're showering. So usually, mainly the breast and the armpit. To watch for is feeling a lump that's usually fixed and hard. Usually it's painless, doesn't cause any pain. That's what we educate patients about.
One thing that's not often talked about is breast cancer in men. This disease can affect men, correct?
Yes, correct. So although it's much less common in men than women, but yes, it can affect men, and that's something that a lot of people are not aware of, especially men who have a genetic disorder that can cause cancers, or men who have a lot of family members with breast cancer or ovarian cancers. Those are at a higher risk for having male breast cancer, and they need to be aware of the symptoms.
What are the symptoms for men, and are they different than what they are in women?
So unfortunately, because of the lack of the awareness of male breast cancer, most breast cancer in men present at a later stage. So the symptoms are usually similar to women, but usually we find it at a later stage when it's bigger, when it's already spread. That's why it's very important for everybody to be aware of that fact.
Sticking with that, is treatment the same for men as it is to women?
Unfortunately, because it's very rare, we don't have a lot of research in the medical literature about male breast cancer. So we extrapolate the research from the woman breast cancer, and we use it to treat patients. So the core treatments, surgery, radiation, hormonal, and chemotherapy treatments are similar in men and women.
We know any type of cancer diagnosis is scary. Is there anything that we can do to help prevent breast cancer?
Yes. So although there's no foolproof way to prevent breast cancer completely, but there are some stuff that patients can do to lower the risk of having breast cancer. Of course, eating a healthy diet, low-fat diet. Exercise has been linked also to lower risk of having cancer. Cutting down or watching alcohol intake also can play a role. And of course, for patients who have a strong family history of cancers or they have a genetic mutations, those are high-risk patients, and they need to be watched very carefully, and they need to talk to their doctors about ways to watch and prevent breast cancer.
We only have about a minute left. Are you able to talk about if there's any new treatments that are out for breast cancer?
Yes, the research in breast cancer is ongoing, and there are a lot of hope and a lot of new treatments coming down the pipeline. So now, on top of chemotherapy, hormonal treatment, other treatments that we've been using for a long time, we have targeted treatment, which basically targets a specific mutation in the cancer DNA, or even immunotherapy treatment, which boosts the patient's immune system to attack the cancer. So these are all new treatments, and we've been using them, and we're using them now in breast cancer.
Doctor, thanks so much for joining us today.
Thank you for having me.
Really important information.